Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today let's learn about colonoscopy CPT coding in a simple way with a practical example. So before we start the session, I just wanted to give you an update regarding my upcoming webinar with AAPC Chennai chapter, which is virtual. Here I'm going to speak about ENM coding and where I'm going to give a practical guide to office or other outpatient setting. Okay, if you are interested and if you are a certified coder and watching this video, then you can register yourself to get 2 CEU points. Okay, you need to stay minimum 90 minutes in the meeting. After that, if you want, you can exit. Okay, so that you will be able to get 2 CEU points to your account. Okay, so yes, let's come back to our session. So firstly, we will understand what is colonoscopy. Okay, so in the CPT colonoscopy concept, you must know the two difference here regarding what is colonoscopy and what is sigmoidoscopy. Okay, which is very important because many coders go wrong by misunderstanding these two concepts. So I am going to break down this in a simple way. So please do watch this video till end, and if you find it informative, please do subscribe to my channel and please do share with your medical coding friends. So yes, colonoscopy is an endoscopic procedure that allows a physician to visually examine the entire colon and rectum using a flexible tube with a camera called colonoscope. Okay, so in the colonoscopy procedure, the provider can access the entire colon and rectum. Okay, that is when we call it as colonoscopy. When we talk about sigmoidoscopy is again a scopy where this procedure is for. So this procedure is to examine the lower portion of the colon, which include rectum and sigmoid colon and part of descending colon. Okay, this is a lower portion of the colon. Okay, it's not an entire colon. So sigmoidoscopy is only for the lower portion of the colon. Okay, it is important, and based on this point, you will easily navigate the colonoscopy decision tree. Okay, so we will see the decision tree later. So as of now, please do understand the difference between colonoscopy and sigmoidoscopy. And why do they use this scopy? The first thing is it is performed to evaluate the symptoms like abdominal pain, rectal bleeding, or to screen for a colon cancer, polyps, or inflammatory bowel disease. Okay, it is all about to find abnormality in the colon. It could be polyp, it could be cancer, it could be inflammatory disease, okay, or bleeding. Okay, so this is all about screening. And with the screening, they do perform therapeutic procedure. But I am trying to tell you that utilizing the scopy, what they really going to do. Okay, firstly, they will screen and they'll find out the abnormality. Next is during colonoscopy, the physician can take biopsy tissue, remove polyps, or treat the bleeding lesion. So further screening, whatever the treatment methodologies they're going to do, could be removal or could be treating the bleeding lesion. It is all about therapeutic procedure. Okay, they are performing the procedure utilizing the colonoscopy. Okay, and under sigmoidoscopy also, you can able to see both diagnostic procedure and therapeutic procedure, where the therapeutic procedure which is applicable for the lower portion of the colon. Okay, say for example, if they are removing colon polyp from the region of sigmoid colon. Okay, so that means the lower portion, then we code it with the sigmoidoscopy. Okay, we cannot code from the therapeutic colonoscopy procedure. Instead, we code from sigmoidoscopy. Okay, this clear picture is discussed in the decision tree. So next, CPT coding guidelines for colonoscopy. So here you can see we have a code 45378, which is for diagnostic colonoscopy. used only when no therapeutic intervention is performed. That means the provider needs to screen. Okay, that means utilizing the colonoscopy, provider is only performing the procedure to identify the abnormality. Okay, that falls under diagnostic. If they do procedure along the screening, then it considered as a therapeutic procedure. Okay. Next, code 45379 to 45398. It is all about therapeutic service, where they are going to remove the polyp or foreign body removal, control of bleeding, biopsy, etc. Next is when multiple polyps are removed using the same technique, code the technique only once, regardless of how many polyps are removed. Okay, here we will have the question: two polyps removed from the ascending colon. Okay, two polyps. By seeing two polyps, you should not give 2 units. Okay, regardless of polyps removal, you have to code one CPT code per one technique. Okay, we will have two technique. One is snare technique and one is hot biopsy forceps technique. So you have to check which technique is utilized to remove the polyp, and accordingly you need to assign your CPT code. Okay, so that is what only one code per technique is reported per session. Next, another important coding guideline is according to CPT subsection guidelines, endoscopy procedure. Okay, colonoscopy is also kind of, it belongs to the endoscopy. A surgical endoscopy is also included in a diagnostic endoscopy. The diagnostic colonoscopy is not reported separately. Okay, during the same session, if they are doing screening procedure also and they are finding the abnormality, after that immediately they are also going to perform the therapeutic procedure. Okay, then you don't have to code two separate codes, one code for diagnostic and one code for therapeutic. Instead, you will code only one code for therapeutic. Okay, because your diagnostic, that is the screening procedure, is an integral part of the surgical procedure. Okay, so now I will explain everything with this decision tree. Please pay attention. And from this colonoscopy decision tree, yesterday also somebody asked me a question. Okay, and from this tree you will get a definite 1 mark question for coding guidelines. Okay, that could be either from diagnostic procedure or therapeutic procedure. Okay, so you just look here. So this is your colon picture and this is the decision tree we have. Under this decision tree, there are 3 different scenarios. Okay, the first scenario is under diagnostic. Diagnostic means, as I said, assume they are only performing it for screening. Okay, they are not performing any procedure. Instead, they are inserting the colonoscopy to identify where the polyp present or where this rectal bleeding happening. Okay, all those things, they are just finding out the abnormality. So first scenario is, it does not, the scope range, okay, whatever the scopy they are taking, if the scope range does not even reach to splenic flexure. Okay, so you can see the splenic flexure is here, and here we have this lower portion of the colon. Okay, this is what the lower portion of the colon. It includes sigmoid colon, it includes descending colon. Okay, so below to splenic flexure, you consider it as lower portion of the colon. Okay, so when the scopy range is here in the lower portion, what you are going to do, you will consider it as a sigmoidoscopy, and you are going to code 45330 for diagnostic procedure. Okay, because you are dealing with the lower portion of the colon. Okay, in the book also you have a separate code set 45330 for diagnostic, and further we have for therapeutic codes as well. Okay, so I'll show you the codes. See, this is the colonoscopy decision tree. For example, if the scopy does not reach to splenic flexure, means you should understand it is all about the lower portion of the colon. Okay, then your instruction is to code from the flexible sigmoidoscopy. The code is 45330. Okay, 45330 is for diagnostic. Okay, now go ahead and see from here. So sigmoidoscopy is here. Okay, so under sigmoidoscopy, 45330 is for diagnostic procedure. And if they perform therapeutic, okay, if they remove polyps, I mean, if they take biopsy from the, assume if they're taking biopsy from the sigmoid colon, okay, this falls under therapeutic procedure. Okay, check the therapeutic procedure, does not reach to splenic flexure. Okay, under therapeutic, what the codes you are going to see? 453312, 45347. Okay, that's the same code I'm showing now. 45331 with biopsy. It could be single biopsy or multiple biopsy. Next, 45332 with removal of foreign body. 45333 with removal of tumor, polyps, other lesion by hot biopsy, forceps. Okay, this is a technique. 45334 control bleeding, any method. So up to here you are going to have the sigmoidoscopy therapeutic procedure. Okay, so that is the clear instruction we have here. So when the scenario comes up with the lower portion of the colon and your scopy is reaching, it doesn't reach even splenic flexure, your procedure is all about either at the descending colon or at the sigmoid colon or somewhere middle. Okay, so then you should check, are they performing diagnostic? Okay, diagnostic means only brushing, like screening method, or are they performing therapeutic? Okay, if they are removing polyp from descending colon, or if they are taking biopsy from sigmoid colon, all these things will fall under lower portion of the colon. So you should code it from sigmoidoscopy procedure. Okay, this is the first scenario you have for sigmoidoscopy, and you should know, you should have a clear knowledge about diagnostic procedure and therapeutic procedure. Okay, easy. Next two scenarios what we have, this two scenario is for colonoscopy. Okay, already I have told you colonoscopy means entire colon. Okay, so when they do in the second colon, assume the colonoscopy crossed splenic flexure. Okay, it went beyond splenic flexure but couldn't reach to cecum. Okay, then what we have to do? So under diagnostic, if they are doing diagnostic colonoscopy and if the scopy reached beyond splenic flexure but not to the cecum, you should code 45378 and modifier 53. Okay, modifier 53 is for discontinued procedure. Okay, I assume there might be a polyp. So because of the polyp in middle, because of the polyp at the transverse colon, they are unable to advance the colonoscopy further. Okay, in this case, they need to terminate the colonoscopy procedure. So what we will do? We will code 45378 with modifier 53. And if it went successfully, okay, if the colonoscopy started from rectum and it reached to cecum, okay, then you are going to code 45378 diagnostic colonoscopy code, but you don't have to use any modifier. Okay, these things are for diagnostic colonoscopy. Next, coming to therapeutic, already first scenario we have discussed. First scenario is all about sigmoidoscopy for the lower portion of colon, and if they do any procedure for lower portion, you have to check the scenario and you have to code from these codes. Next, beyond splenic flexure but not to the cecum, same scenario, but here what they are doing? They are actually performing the procedure. Okay, under diagnostic, they were only doing screening, but here under therapeutic, they are doing the procedure. So assume there were a colon polyp at the transverse colon. So they're removing the removing the colon polyp utilizing the colonoscopy from transverse colon. Okay, in this case, what we have to do, we are going to code from 45379 to 45398, and here again you have to check what they are removing or what techniques they are used to remove. Okay, all the codes we will see later. And then lastly, if it goes complete, if it reach to cecum, then also same codes. Okay, but we don't use any modifier here. In the second scenario, we are going to use modifier 52. It says reduced service. Okay, reduced service means whenever you are going to code halfway, okay, that means you are not going and reaching to complete colon. Instead, your procedure is in the halfway. Okay, that is reduced procedure. Okay, so if it is clearly documented, you can use 52 modifier with the above codes. If it is not documented and if they are advancing colonoscopy to the cecum, then we call it as complete colonoscopy and there is no need of using any modifiers. Okay, so see these codes 45378 to 45398. So up to here, it is lower portion, that is sigmoidoscopy. After that, you have codes from 45378. This is a diagnostic colonoscopy procedure. And from 45379, see, from 45379 is all about therapeutic, okay, procedure, removal of foreign body, okay, and with biopsy, single or multiple. 45381 with directed submucosal injection. 82 control of bleeding. 88 ablation of tumors. 45384 with removal of tumor, polyp, other lesion by hot biopsy, forceps technique. 45386 is transendoscopic balloon dilation. And one more code we have 45385 with removal of tumor, polyps, other lesion by snare technique. Okay, these two techniques are important. Any one technique can be questioned. Okay, and remaining also we do have codes up to 45398. Okay, with band ligation of hemorrhoids. Okay, so 45398. In the decision tree also you could see the code range starting from 79 to 98. It is all about therapeutic procedure. You need to check what exact procedure they are performing. Okay, so please know the decision tree, and if you get a coding guideline regarding the decision tree, come to this page. Okay, there is a decision tree in the book as well. Okay, come here, check the question, what, like, are they asking diagnostic or therapeutic, and check your scenario and code it accordingly. Okay, they'll ask about modifier usage. For diagnostic, you're going to use 53 modifier if the scopy crossed beyond splenic flexure but not to the cecum. But same scenario under therapeutic, you're going to use 52 modifier. Okay, this modifier usage is important. And if it is lower portion of the colon, and if they are performing only diagnostic, you will code 45330 as your code. And lower portion and they are performing therapeutic, then you will code from here. Okay, simple. So next we will see one practical question. Okay, and then we will conclude our answer. By now, if you have understood so far, easily you can get the answer. Okay, easily. So if you really want, if you're watching right now, you can pause the screen and you can try your answer. Okay, so let's take this question. So the preoperative diagnosis is history of prior colon polyps, and post-operative diagnosis, patient is having colon polyps, diverticulosis, hemorrhoids. Okay, there are three problems. Next, what the procedure they are doing? After the sedation was provided by anesthetist, the rectal exam was performed by a gastroenterologist, and revealed a small external hemorrhoid. The video colonoscopy was passed without difficulty from anus to cecum. Okay, this is one clear key point, that your colonoscopy started from anus and reached to cecum. Okay, that means it is a complete colonoscopy. Okay, it reached to cecum. So it's a complete colonoscopy and there is no need of using modifier. Okay, next, the colon was well prepped. The instrument was slowly withdrawn with a good views obtained throughout. Okay, so that means till this they are performing diagnostic. Okay, they are taking the views, they are finding out the abnormalities. Further, what they are going to do, there was a 3 mm polyp in the proximal ascending colon, and this polyp was removed with the hot biopsy forceps and retrieved. There was a 4 mm rectal polyp located at 10 centimeter from the anus in the proximal rectum. So totally there are 2 polyps now. The polyps were removed by hot biopsy forceps. Okay, 2 polyps removed, but you need to check about which technique being utilized. So for the first polyp also they used hot biopsy forceps, and the second polyp also removed using hot biopsy forceps technique. Okay, that means 2 polyps removed using hot biopsy forceps technique. You already know the coding guideline. You will not add units based on polyp being removed. Okay, for each technique you are going to use only one time. Okay, that guideline already I have discussed in the earlier. Next, there was also a moderate diverticulosis extending from hepatic flexure to a distal sigmoid colon. Okay, so they have observed that there are hemorrhoids and diverticulosis, but they did not take any action towards it. They took action only regarding colon polyps. Okay, that is the overall question here. So you need to note down 2 points here. One is one coding guideline, important coding guideline. Okay, that guideline is regarding both diagnostic procedure and surgical or a therapeutic procedure performing on a same day. Then what is the one procedure you are going to assign? Okay, then the answer should be therapeutic, because diagnostic is included in therapeutic procedure. Okay, that one point. Next one is 2 colon polyps removed utilizing hot biopsy forceps. Easy. Okay, so let's see the codes: 45384, 85, 88, and 84 with units 2. Units 2 you have easily by seeing itself, you can eliminate this option. And 45378 with 59. The 78 procedure is for what? 78 is for diagnostic colonoscopy. Okay, diagnostic colonoscopy, you don't have to code it separately. Okay, eliminate option D. Remaining, just check the code description. 45384. 45384 is with removal of tumor, polyps, other lesion by hot biopsy forceps. Okay, this is correct because our technique is hot biopsy forceps. Remaining 45 is snare technique. Okay, and 4588 is where is that code? Code is out of numerical sequence and it is there between 45381 to 85. Okay. 81 to 85. Between here we have the 45388 code. So it is with ablation of tumor or polyps. Okay, they did not do ablation procedure. They removed colon polyps using hot biopsy forceps. So our answer should be 45384. Okay, option A is correct. Okay, and you can see the rationale for this. So as we already discussed, there were 2 polyps removed using hot biopsy forceps. One is 3 polyp at proximal ascending colon, and another one is 4 polyp at proximal rectum. Okay, no additional technique used. And also diverticulosis and hemorrhoids were observed only, and there were no therapeutic intervention performed towards hemorrhoid or diverticulosis. Okay, and also according to CPT guideline, our diagnostic is included in surgical procedure. Okay, so hence your answer is option A, which is 45384. Okay, so this is all about colonoscopy coding. Know the colonoscopy decision tree. Okay, and know about the techniques. Check the technique, what technique they are using to remove polyps or foreign body. Okay, and easily you can get a colonoscopy marks if they get a question. I mean, if you, like this year also there is a question regarding colonoscopy. So if you understand this class, easily you can secure 1 marks. Okay, so yes, that's all for today, and I hope whoever watched this video have understood. Okay, and also if you are currently preparing for CPC exam, the meaning you have already completed your training in some institute, but now you want preparation in the sense you might have taken training last year, or you have a gap, or you might have attempted CPC exam and got failed. Okay, all of you people can join my CPC live classes, and it is going to start or begin from July 14th. Okay, already I have created a class group, and many of the students have joined. So if you are interested, you can text me on WhatsApp with your name and with your requirement. Okay, I'll respond, and like as I said, the classes will begin from 14th July. Thank you all. Thank you for watching. I hope you have understood little, at least, about colonoscopy and sigmoidoscopy. That's all for today.